I'm Tanya Marwaha. I'm 23 years old and I am from London in the UK. Working professional, I run my own business focused on mental well-being, suicide prevention, disability and diversity and inclusion. My mental health journey started when I was as young as I can remember, but I think especially when I was around 11, 12 years old as an early teenager, that's when I remember first really struggling with my mental health. I had a lot of negative feelings and a lot of negative thoughts, but I didn't know why I was feeling this way. And especially being so young, I didn't know how to express what was going on. And I didn't want to upset or disappoint anyone. I didn't want to share it with my parents or anyone else. And that was the start of my mental health journey. And at the same time, I was struggling with my physical health. So I developed chronic pain and chronic fatigue. And every time I went to see a medical professional, no one knew what was going on. Everyone said it was stress, or maybe it was just growing pains, or it was something that would eventually disappear. However, as I went on in my teenage journey, my symptoms both physically and mentally got a lot worse. I struggled with suicidal ideation. My first suicide attempt was when I was 13 years old, and the physical health got a lot worse. And I really struggled because I didn't know who to speak to and how to speak to them. Eventually, when I was 16 years old, I was diagnosed with anxiety and depression. So I started talking therapy, counseling, antidepressants. Some things helped, some things didn't help so much. And then it was only when I was 19 years old, I got diagnosed with my physical health conditions. So I got diagnosed with fibromyalgia, which is a complex chronic pain condition, and Ehlers-Danlos Syndrome, which is a connective tissue disorder. So I lived a lot of my teenage years with struggling with both my physical and my mental health. And now I'm 23 years old. I'm still dealing with those challenges. So even though I've been diagnosed for 4 years now, I still find that I have to advocate for myself with medical professionals who sometimes don't believe me, or they will dismiss kind of what I'm experiencing. But I think for me, it made it really clear who wanted to understand truly what I was dealing with, now that there was something that they could look into, and then maybe those who didn't wish to understand further. It was when I was 19 years old. Earlier that year, I had been diagnosed with a physical health condition, so I had those answers now. And I was really, really struggling with my mental health. That was my most recent suicide attempt. And I think that I had to have an honest conversation with myself and think about, I've accepted that both the physical and the mental health conditions are things I'm going to have to live with for the rest of my life. I've been going through this up and down cycle for around 7 years at that time. So I can't escape this. I've tried fighting against it and it doesn't make anything better. It makes it worse when I fight against it. So how can I find a way to accept and work alongside the potential positives of this experience? So that's when I got this passion for advocacy and talking about it. I think especially in the Indian community, South Asian community, you're taught not to talk about things that are shameful or perceived as a weakness. And I just thought, if this is something I have to live with and I perceive it as something to be ashamed about, then I'm never going to be happy. I'm never going to be able to truly accept this. So why not challenge that and actually talk about it and make other people question why they think it's a shameful thing? So that just started my journey of speaking out, not just speaking out online, but in social circles, in family situations, in community situations. Because I thought, if I don't start the change that I want to see, I don't know if the change will happen. Your well-being is the most important thing in life. I think we live in a society, especially with social media, where we feel like all of these other things are really important, whether it's career, family, especially doing things for other people's happiness, but actually remembering and constantly reminding yourself that your well-being is the most important thing in the world. There is no life and happiness without your well-being.